Right. So again, in advance of Arab Health, I'm sure most of you will be aware of the exhibition, the Arab Health exhibition, which is the largest healthcare and life science exhibition in the Middle East, taking place end of January in Dubai. We thought we would hold this webinar to explore opportunities and provide everyone with an overview of the healthcare and life science sectors in Saudi Arabia, which is the largest market in the Gulf region. So just to start with some housekeeping, and to make sure everyone can hear us okay, there will be time for question and answers at the end of this presentation. On the right-hand side of your screen, you'll see a panel that will enable you to type questions that you might have, and we'll of course address those at the end of the webinar. After the webinar, we will provide the contact details for the healthcare and life science team at Embassy, our speakers, and the team here at AEI, so you can get in touch directly should you have any questions. This will hopefully be about 45 minutes. We'll have time about 15 minutes in the end for questions and answers, so in total an hour. Just to introduce everybody, my name is Yazan Shukair, and I'm head of the marketing consultancy at Arabian Enterprise Incubators, or in short, AI Saudi. I'm joined here in Riyadh by Aya Matouk, Mena Salama, leading on the the healthcare sectors in the British Embassy here in Riyadh. We also have Ayman Abedi, who leads on the life science sector based in Jeddah. Also joined here in Riyadh by Graham Jelly from PwC. Also dialing in, Yano Andrade and Walid Abu Shadi from JSK. Alexandra Ostendorf from the Department of International Trade in the UK. Right, moving on. Just to give everybody a quick overview of AEI and what we do. This slide gives a very quick overview of our services. I'm not going to go into details, but in summary, these are all our services that we offer to help you as a company navigate your way through the Saudi market. We are the exclusive delivery partner for the Department of International Trade in Saudi Arabia, and we assist with everything from general inquiries to market research, hosted visits, and route to market strategy. Of course, we can also provide in-kingdom support, so accommodation, transport, letters of invite for anything that's difficult for Saudi company, we can assist you with. Right, so a general update, moving on with the general update, I just wanted to start with a few things that are going on at the moment in Saudi Arabia. You'll see on the right hand of your screen some pictures. Right. You'll see on the right hand of your screen some pictures from here in the kingdom. In the top right hand corner are the skydivers over Neom. You'll also see a picture from the Formula E race that took place here in Riyadh last month, and a couple of other pictures in the bottom right-hand corner that is the design of one of the flagship hotels at the race project. I think it's important to state that there's no way I would have been saying mentioning any of these events until recently. The cultural impact and the giga projects that have been announced recently with Vision 2030. We've seen many changes recently here in Saudi, from events taking place to concerts, to the opening up of the kingdom to foreign investment, to the announcement of giga projects. All of these things have happened recently, and we are seeing the change here in the kingdom. So moving on, I'm just going to speak a little bit about Vision 2030. For all of you who haven't heard about Vision 2030, it's a plan that was announced by the Crown Prince in 2016, and it's a plan to reduce the dependence of Saudi Arabia on oil, diversify its economy, and develop the public sector, specifically health, education, infrastructure, recreation, and tourism. The vision goals include reinforcing economic and investment activities, increasing non-oil industry trade between countries through goods and consumer products, increase the number of jobs available to the young Saudi population, and increasing government spending on military and manufacturing equipment in the country. In addition, we've also seen a number of events and programs happen over the last 2 years. And of course, that has all been done by the General Entertainment Authority over here. And those include musical events, singers, comedians, even circuses taking place here in Saudi. You'll see some of the pictures at the bottom. The marathon that took place in Riyadh in 2018. Of course, the picture beside it is Women Driving, which has also the ban which has also been lifted back in June 2018. You'll see a picture from Comic-Con, a picture of popular in the Gulf performing in Saudi Arabia, and of course DJ concerts happening in Riyadh very recently. In terms of the structure of Vision 2030, the main element is the Public Investment Fund, which will be transferred into the Kingdom's sovereign wealth fund and has ambitions to manage at least 2 trillion worth of assets and investments. Just before I wrap up, I would like to finish with the 5 P's and things to be mindful and considerate of. This is an advice that we give to everyone that's looking to enter the and it starts with planning, making sure before you consider the Saudi market that you have a robust plan that will keep you on plan and on track in Saudi. Patience, as I said, having patience will be a part of the planning strategy. Vision 2030 is moving quickly, but opportunities, paperwork, and red tape means that it could be a year or more until you see any. Presence, those of you who are operating in the Middle East already know how important it is to build a relationship with local partners and to be seen by those who you want to work with. Emails and telephone conversations will get you far, but you really need to commit and not commute in this region, in this part of the world. Partners, again, like everything mentioned above, it's really important to consider who you will partner with. If you choose to go down this road, we normally suggest and recommend not giving exclusivity. And of course, payment. Perhaps the most important part of your plan is having capability to manage how you'll get paid. No contract is without its risks, of course, and there are certain things that you can mitigate these risks. You can get delayed payment insurance, providing performance bonds, and a whole range of other services. And of course, find out more how you mitigate the risk from payments. And again, we always recommend getting as much money as possible upfront at the start of a contract, only to offset any heavy upfront costs. I'll hand now to my colleague, Ellie from PwC, to speak about the Saudi health market.
Hi everyone, thank you for joining. If I quickly move on to the first slide. So if I cover off very quickly a little bit about the Saudi health market. I've been in the country now for about 4.5 years, so right at the very start of Vision 2030, helping identify the initiatives and then helping build the strategy that MOH currently is deploying across the kingdom, and also across many of the other ministries. And I'll come on to that in a minute, because it's very, very different than, for example, a UK system. Just a bit of an overview. It's about country 684 billion in GDP, about 33 million population, very young population. It's got a demographic profile that most countries around the world would just die for. That's probably a really bad turn of phrase, but really, really young population. So actually the demand for healthcare should be relatively low, but they've got some real lifestyle problems. The temperature here means going outside and exercising becomes a challenge. So they spend a lot of time in cars, in malls. So exercise is very low, and the diet is very high in sugar, high in fats. So actually they've got a problem in the longer term, medium to long term now, with potential chronic diseases. And we're seeing at the moment, they've got the 3rd highest incidence of under 16 diabetes, obesity levels similar to Western countries. So everyone was focused on this and how do we change this and turn this around. The provision of healthcare is interesting. We actually have two health systems here. If you're an expat, which makes up about 40% of the population, you're provided with insurance and you use private sector hospitals. And there's a range of those, some very good ones here, and they provide a very good high quality of care. If you're a Saudi national, you don't get insurance because you're employed by the government. You don't get insurance. You can access a health system, Ministry of Health and Ministry of Education, provide healthcare to any Saudi. And then if you work for National Guard, Ministry of Defence and Aviation, Ministry of Interior, Ministry of FSH, you can access the health services provided by that ministry. So what we have is quite a lot of overlap. I'll move on to the next slide. So we're just going to get the slides correctly. Right. We've touched on Vision 2030. So these are the health objectives for Vision 2030. And you can see there's a very strong focus on exercise, on preventing ill health, focusing away from primary care. So there's a lot of hospital provision here. So people will literally turn up at hospital to see a specialist. Now, they may not know which specialist they need to see, but they'll turn up and they'll get to see a specialist there and then. So it might be completely the wrong one. Huge amounts of rework and transfer between specialists because actually you've gone to the wrong one. And what they're trying to do is reduce the amount of duplication in the system, increase the efficiency, and they see primary care as the gatekeeper being one of the roles. What I would say, and it's particularly relevant to this audience, we spent a lot of time with the Minister and the Ministry of Health looking at health systems around the world, and actually the UK health system is almost direct comparison to the Saudi health system, but the UK health system back in the late 80s, early 90s, for those of you who are old enough to remember what that was like. So how the system operates here is exactly the same in the government sector. It's all budgets. It's about patients and not being responsible for patients, having no levers to control it. So effectively, every single problem that I recognise from the NHS in the early 90s is here now, and they're moving away from that. Now, just as a little bit of background, they're moving to a Spanish ACO model, accountable co-organisation model, based on the Alzira model. So Roberta Salud, who were running Alzira and County health systems. Thank you. As you can imagine, because they love bureaucracy, there is an awful lot of targets. So here's an example of some of the targets that you will see, and I'll talk a little bit more in general terms in a minute just around the key themes, because actually that's probably more useful for you. But you can imagine within each of these objectives, there's a series of targets that people will be focused on and looking at delivering. So if you can align your either solution or your product to some of these targets, then that immediately enables you to start a dialogue. And they're also prepared to invest. So the reason I'm here is they have about 23 billion over the next 5 years to spend on all of these health initiatives. So whereas you go to most of the countries, you've got to save money and then invest that. Here, actually, they're quite happy. They'll spend the money and they just want you to go ahead. Fabulous. So I'm going to go with this. So I'll apologise now. They've given me a Mac to work, and I am absolutely a PC person. It's far too complicated for me. So, just on the Ministry of Health. Ministry of Health has 7 themes that it deals with, and I'll talk a little bit about all of these. Model of care. So effectively, they took a decision that they built a system in the 1950s that was fit for purpose in the 1950s, is no longer fit for purpose. They're not, the systems, the processes they use were very bureaucratic, very process orientated. It wasn't best practice. So what they took the decision of was actually we need to redesign our health system bottom up. So they engaged stakeholders, doctors, nurses from across the country, across all of the different health systems to redesign their model of care. So they have a number of themes within this. So end-of-life care, planned care, urgent care, all of the things that we recognise. And what they've done is they've developed national pathways. They've linked those out to, they've rolled those out to pilots, and they're now rolling them out into the regions. And this is basically rebuilding their whole system bottom up, focusing on prevention, focuses on primary care more, and the aim being to shift more care out of hospitals, which is high cost with potentially low outcomes, and move it back into primary care and even community care. So for people who, I know we've got some people with genomics, a big focus, they have lots of co-sanguineous marriages here. So actually genomics forms a really big part of the women and child theme, because they want to avoid the number of genetic diseases they get and they have here and have to deal with. If I move on to healthcare financing, so we need to go back, sorry, I'm going to go around the circle. So healthcare financing is another thing. At the moment, it's budget-based. What they want to do is they want to move away from budget and move to a capitation-based. So they've talked about ACOs, and I'll talk about that. Clustering is coming up in a minute. But in essence, what they will do is they will define for populations a budget based on head of population. And then it's the responsibility of the ACO or the cluster to provide all of the healthcare they can within that budget. Now that's a completely different way of looking at things than they currently operate. It will be exactly like activity-based funding, the changes that you saw with that in the UK. And they will have an element of costing, coding and revenue cycle management within it to enable them to map actually how much is being spent on individual procedures, interventions, etc. Corporatization, I talked about model of building the system bottom up. Corporatization is building the system top down. So this, they're actually defining populations and groups of hospitals. They're creating clusters in the first instance. These are 30, 35 primary healthcare centres, 3 to 5 secondary care hospitals, and possibly a tertiary centre as part of a cluster that will become an ACO, an accountable care organisation. And we have 3 of those up and running at the moment in pilot form, another probably 4 or 5 in shadow form at the moment. Governance, they recognise this as a complete change from what they've got there. At the moment, all of decision making is at the top of the organisation, and what they need is decentralise and bring that decision making down. So having the right governance in place is critical. So there's another strand of work looking at how do we operate, and it's moving the MOH from provider of services to being a regulator. So it will become the regulator. As part of that, it will have specialised regulators around the outside, which will be things like Saudi Food and Drugs Administration, etc. Private sector participation is actually a really exciting opportunity. So there's a number of initiatives. I think they had about 7. They're focusing on 2 or 3 at the moment. So radiology and labs is one. They're also looking at some hospital provision. And what they want to do is they want to bring the best from around the world and bring to get that step change in the provision of care. They also want to bring in additional funding, and they want to move from the model they currently have, where they've both got CapEx and OpEx responsibility, to maybe even just an OpEx-driven model similar to the PFI scheme in the UK. E-health, it's an interesting one. On e-health, they recognise that probably 5–10% of their hospitals have an EPR system, probably more have hospital information systems, but actually they recognise the importance of having good e-health. There's an initiative currently to put EPRs and hospital information systems with PACS and RIS into every hospital, Ministry of Health hospital in the Kingdom. The plan in place, there's a slight disconnect in culture. So what we have is a very centralist-driven model that's moving to the future, which is decentralised. So at some point, you'll see that flip where it isn't the centre buying and operating systems like Connected Health tried to do. It will move to more decentralised, where the ACOs have more control. So at the moment, the main buyer is the Ministry of Health, but in the future, 5 years, 3 to 5 years, that will switch across to being more the clusters looking at buying their own e-health systems. And then finally, I know we've got some training and development people on the call. There's a big focus in workforce at the moment, and predominantly on Saudi. So they've got 2 targets, which are not great, but it's based upon the work of some. One is increasing the attractiveness of nursing as a profession, and the other is increasing the number of doctors. And to put this into context, here in Saudi, anywhere between 60 to 80% of the workforce in hospital is expat. And, you know, even when you look, they recognise that if you look around the world, I mean, WHO says there's 15 million shortfall in workforce by 2030. At the moment, they're pulling from the Philippines, they're pulling from India. Actually, what you're finding now is, because of an ageing population in the West, more and more to the US is beginning to target Philippines. The UK has been overseas recruiting for many years. It'll be harder and harder for them to recruit. So they're trying to now move to more Saudi-based staff. Some of it is actually to increase workforce, and so employment in the Saudi population, but some is recognising these big geopolitical challenges that are going on at the moment and demographic challenges. Okay, next. This is focused on the other health sectors. What I didn't put in, apologies, there is about 274, 280 Ministry of Health hospitals around the kingdom. But I mentioned and touched on the fact that the ministries themselves, other ministries, have their own health systems. So Ministry of Defence has 27 hospitals, primary healthcare system, and it says it's responsible for about 7 million population. So when in the UK, for example, you may focus on your NHS, your target market. Here, actually, there's a range of different stakeholders you can target. Ministry of Interior, they've got 3 hospitals, 2 medical cities under construction. They say their responsible population is 4 million. National Guard's 6 hospitals, 3.5 million. Ministry of Education, 12 hospitals, 8 more being built. They say they've got about 3.5 million population. And King Faisal Specialist Hospital, which is the major national provider of tertiary and quaternary services, the big national services. They've got another hospital under construction out in Jeddah. All of these organisations at the moment, when you talk to them, are talking about, okay, we recognise the challenges of building new services and we want to partner and bring in entities to provide specific service. And it may be around, for example, proton beam therapy, it may be around cancer treatment. But they are willing to at least engage in a dialogue to actually bring the best in, and they would see that as a real win internationally. Oops. Sorry, modern technology. I've just put some final slides in just to give you an idea on regional differences. What I would say is historically they built around the belt. So this is the line that goes from Jeddah through Riyadh out to Dammam. Most of the hospital builds over the last probably 30 years and the investment has been in that belt. They recognise there's now a disparity. So if you live out in the northern region, you've got poorer access to healthcare. So what they're trying to do now is address the balance. So what you will see is far less investment, certainly in infrastructure along that belt, and far more happening in the north and the south. And we're seeing that there's 2 medical cities being built, one in Al Juf and one in Abha, and that's to begin to rebalance tertiary care, but you're also seeing it as well, they're targeting investments in hospitals in other regions, apart from Riyadh, Jeddah and Dammam, where at the moment they are overpopulated. So I'll probably leave it there. That should give you a general flavour of the region. I probably talked too long, so apologies. But if there's any questions, we can deal with them later. Thank you very much. Yes, can I just hand over to Luciano? So Luciano is going to cover off the next part of the session.
Hi. Luciano, can you hear us?
Hi, can you hear me now?
Yes, we can hear you.
Yeah. Hello. Good afternoon, everyone. Thank you, Graham, for your presentation. I actually already covered a lot of the healthcare. I'll try to show it here from an investor perspective and complement a little the very rich information you shared with us. So the first way I'd like to start this presentation is defining a little. If you go to the next slide. How I believe we should define Saudi, the momentum of Saudi Arabia. If you can come back, sorry. The one, yes, thank you very much. Because the way you see these pictures here, I think reflects a little the momentum of the country, where you have this conservative young country, as Graham said, a very young population, but also a very young country that really started to operate as Saudi Arabia in the 40s. And you have the situation with more than around 65% of the population below 35 years old. And with the crown prince that is really running the operation of the country, let's say like this, being also very, very young and represented this part of the population. So you have all the obvious religious conservative side of the country, but contrasting with this youth on the population, and at the same time facing what we are calling the short-term turnaround impact, but a turnaround impact caused by a clear transformation plan for the long-term growth. So the way you set Vision 2030 and all the transformation you need to do in the society, in the economy, on the government sectors, so all this is happening at the same time in an unprecedented pace, I would say. So is generating, of course, an important short-term impact. So this economy and healthcare sector or pharma sector was growing a high single digit until 2014, 2015, but then you start to see the slowdown, and when all the reforms started, you can see last 2 years, for example, pharmaceutical market basically is steady, not growing at all after a long period of good growth. And the same expected for 19 and 20, probably the same trend. But when you look at the long-term opportunity for the kingdom and the direction all the reforms are taking for 2030, we as investors continue to look at Saudi as a good opportunity, medium long term. Maybe pressure in the next 2 years, but really believing after 2022 up to 2030, the growth will come, especially because you have a population growing at 2.5% a year, and all the reforms increasing the Saudization and increasing the employment of the Saudis, of the females, what makes an important change in the economy also, because when you had a very strong expatriate workforce, in the end, a lot of people saving to send money out of the country. In the increase of the Saudization also, what you start to observe is the Saudis, of course, is spending much more locally than the expatriates that used to send out. So when you put all these factors together, we still believe in the potential of Saudi Arabia as the main place to invest in the Middle East region, and we as an organization are increasing our footprint here. If you go to the next slide, please, just a quick turnout. We've been in the country for more than 60 years now, and we were the first multinational company to start to manufacture in Saudi Arabia 25 years ago, covering today 11 million. And after this period, so today 80% of my products are locally supplied on our own factory here in Jeddah. So looking all this scenario, go to the next, and trying to complement what we were trying to say about the healthcare. So I think Rehan give very important details and summarize it very well. Maybe to complement here, I think this vision of the MOH to move in a long term from a provider of healthcare, but actually to concentrate the MOH only on the prevention, regulation, and governance of the healthcare sector, bringing it much more to the private sector or to the independent organizations that they are starting to build. And more than a speech, because initially there was a plan of doing a privatization of the entire system, and this plan was not possible to achieve because the complexity, the level of productivity problems you have today. So there was no interested buyers or people investing on this whole system as one. So then came the idea of the clusters, and they already started the implementation of the clusters, trying to create independent healthcare provider clusters that can bring more productivity to the system, and of course can be easier to digest in a direction of privatization. Other initiatives you start to see in this direction, and I'll call the attention here, for example, for Wasfati project, that is basically they started to shift the distribution of medicines from the public sector to the private, to use the private system. So basically in the past, until last year, the patients of the primary healthcare clinics that Graham showed distributed across the kingdom, every single primary healthcare clinics, they had their own pharmacies. the public healthcare clinics. They had their own pharmacies across the kingdom, more than 3,000 public healthcare clinics. What they are doing now, they start to close all these public pharmacies inside the polyclinic, the public polyclinic, and they started to create this e-prescription where actually the patient, the doctor prescribe in the public clinic and send this prescription to be collected, the medicine, in the private pharmacy, in the big chains. So this already started. It's going region by region, but they are already covering almost 1,000 polyclinics now, so 1/3 of the polyclinics, and it's, in my opinion, no way back, a movement that they are doing for the next 2 years. The plan of the government is not just do it in the primary healthcare clinics, but try to expand it for the entire primary care setting, including the hospitals, primary care service, and try to do the distribution using more and more the private system of medicine distribution. Another important part of this dynamic in the healthcare, as described earlier, is what I'm calling here the Saudization. Yeah, so there are a lot of initiatives across all the sectors, and healthcare is not out of it, of increasing the number of Saudis. And just to share, for example, the experience in the pharma sector, last year was published, all the pharma companies, for example, all the medical representatives of the pharma companies needs to be Saudi by the mid of 2021. So they give the pharma industry 2 years to move from no target of Saudization to 100% be Saudis. Of course, it represents a big challenge in managing the teams that are currently in the company, and at the same time to develop the Saudis. So that's one kind of example is being doing in Saudization. But in the end, what the government wants is really to employ these young Saudis that are graduating from even some initiatives from the government that supported a lot of students to go to study abroad, paid by the government, and now they are returning to the kingdom without their first job. So the government is forcing the diverse sectors to start to absorb this workforce. It's challenging because you need to of course work on the capability development, and sometimes you don't have enough time or experience to develop it. But what we see is an increasing mindset of understanding the private sector, the dynamics, and I can say to you, even in 3 years, I can observe a completely different scenario. What are the profile of the fresh graduates we received 3 years ago, and the profile of the fresh graduates we are receiving today. So it's really improving in the direction of being a more modernized and more fitting the private sector ways of working. And the third point is the localization. The government has a series of initiatives to expand the localization, and you start to see some privilege being given in terms of pricing, of tender advantage for localized products. Just 2 days ago was published a local content rule that start to create some rules for purchase of medicines, creating some favoritism to local produced products on behalf of imported products directly. So these three dynamics are there, but if I go to the next slide, one thing is very important, and Graham highlighted it. So while majority of the governments are trying to cut healthcare budget, you have money to invest here, and you have a huge appetite from the authorities, from the system, and from the population, a huge appetite for innovation. Yeah, so even in the total healthcare or in the pharma industry, you see this appetite. For example, nowadays we can get approvals from SFDA for a new medicine in 30 business days after it's been approved by FDA and EMEA. So you can pick the same file, submit here, and depending on the profile of the drug, you can get approval in 30 business days. What is an unbelievable improvement from 3-5 years ago. At the same time, SFDA adopts a high quality standards for the review of proven safety of new products. So they are really keen on the quality standards from SFDA perspective. One thing to highlight for the innovative companies is we are still perceiving some challenges on pricing, sometimes in the beginning, but mainly on IP process. And here I'll do a parenthesis. We had some cases in the last 3 years of clear IP rights from pharmaceutical industries being ignored, and the government allowing generics to come and even buying from the generic company. A huge effort is being done on it. And what I can say is that all the senior authorities we interact with from a pharma industry perspective are very keen and clear that they support innovation, they support IP protection. There is no intention to use IP bridge or whatever to make pressure or something like this. They are very, very keen and clear about they want to protect IP rights and all these things. But there is a gap in the process itself. So these cases that happened, what we see is a clear gap in the process on the controls of IP by the authorities inside the kingdom. So the government created recently an authority, SAIP, that is the South Authority for IP, and they are trying to work to really nail down it and create the right controls and process. So the intention is there. The intention is to protect IP. It's important to share with you that sometimes it's challenging the process of IP itself. Moving a little to the national e-health strategy. So I'll not repeat what Graham already said. If you can come back to the slide, just yeah. So the strategy is clear, and they believe on the 5 years horizon. A lot of plans in place to use e-health as one of the initiatives to support there. And can you come back one slide? Sorry. Sure. In the innovation slide. Because one thing I'd like to highlight is even in the purchase, you see clear growth of the innovation in the purchase side. Today, innovative pharma is growing 33%, while the market is a very low single-digit growth. And today, for example, oncology, immunology, and vaccines are representing 1/4 of the public market, and they are the fastest growing therapeutic areas. So there are appetite for innovation. There are support from the government to innovation. It's more a matter about the pricing and IP as a challenge in this scenario. So as a conclusion from my side, and as investor, as a pharma industry, that is the last slide, is I think the vision 2030 is clear. So vibrant society, thriving economy, and an ambitious nation, and all the transformation they are doing. You can argue maybe the coordination, because a lot of initiatives come at the same time, and you can miss a little the coordination among the multiple initiatives. But when you look the initiatives isolated, all are in the same direction, and it's towards the Vision 2030. So understand the Vision 2030, these goals. It's very important for anyone that's planning to come to Saudi. I think the key pillars for the healthcare about localization, Saudization, privatization is very clear also. But important to keep in mind that the government is focused on increasing the quality of life and life expectancy. So innovation is being highly appreciated by the government. I would say any player in Saudi needs to be really agile to cope with a transformational environment. I like the sentence it showed in the beginning is commit instead of commute. So being close, being well connected, it's very important to anticipate some movements that is happening, and a lot of things is happening at the same time. Pricing and reimbursement are under increasing pressure in the pharma industry, and there is some movements to make a more mature reimbursement system, HTA system, more connected with what you see in Europe, as described the Spanish model, but so and by the end is IP process can be a challenge, but there is an intention and movement from the government to sort it out. It's just an important piece to be connected. Okay. I think from my side is it. I would like to hand over now, and I'll be happy to answer questions in the end. I'd like to hand over to Alex from Healthcare UK.
Alex, are you on the line? Sorry, everyone, we're just waiting for Alex to join the line. Just be a couple of minutes.
So just while we've got a bit of a gap, the other, I didn't mention it in my bit, but the other relevant bit of information that might be helpful to people on the call, they're also here setting up a new agency to manage procurement. NUPCO is the organisation. Effectively, that will operate very much like NHS supply chain. In fact, to be honest, it was modelled loosely on that. But it will be a far more, it's got far more power than NHS supply chain. So we're in the UK, you've still got the ability for the chief scientist to agree a formulary. Here, that was managed ultimately by NUPCO. It's still in very early days. But you can be more important in the future.
Question, you can ask questions or ask questions. But they will answer when we don't know. Monday मिलता
मैं I'm not going. ठीक है ना?
She's not muted. She's not even showing this.
So hi everyone, we're still trying to get Alex on the line, which apparently we have some technical issue. Anyway, I will take her part and brief you about her part, about Healthcare UK and our health plan. It's just first to begin with, the people who doesn't know me, Amaya Matu, I lead the healthcare sector at the British Embassy in the Department for International Trade. And sorry, Alex, I am taking your part. I know you're really keen to participate in our webinar today. So I'm just going to give a bit of background on Healthcare UK. So Healthcare UK is a joint initiative between the Departments of Health and Social Care, DIT, and NHS England, with its headquartered in London. Healthcare UK helps healthcare providers to do more business overseas by promoting the UK healthcare sector, to oversee market and support healthcare partnership between the UK and overseas healthcare provider. So the MEAP team covers 6 GCC countries and 6 non-GCC countries. And they work very closely with the IT trade advisor at Post, in each of these countries, as well as the Healthcare UK team consisting of specialists and international trade advisors in the UK. So I'm going to give a bit of background on Arab Health itself, which the objective of the webinar today, to promote it to as many companies as we can so they can participate in the conference, because definitely it's a destination where people want to do business in the region. It's definitely a diverse destination to go to. Arab Health 2020 will take place from 27th to 30th of January 2020. So it's the largest healthcare and life science exhibition in the Middle East, and they do provide the perfect opportunity to showcase UK expertise and services to the Middle East, and definitely to explore regional healthcare demands. Arab Health 2020 is expecting to attract over 55,000 attendees with 4,250 exhibiting companies, representing over 159 countries. The event will be attended by UK and Middle Eastern businesses, public sector organizations, and definitely governments. And we definitely encourage you to participate or attend if you haven't already. So what is the program of Healthcare UK during Arab Health? So previously, what Healthcare UK have done, they have supported in Arab Health exhibition, they have supported previously 200 UK organizations in the UK group with visits from UK ministers and senior officials, and gave them access to trade advisor based in the Middle East and further afield, including China and even Southeast Asia. They held side events aimed at raising awareness of marketing opportunities and several networking events. They have introduced UK organizations to oversee buyers in specific subsector, for example, the artificial intelligence. So the Department for International Trade, including Healthcare UK and the Life Science team, which will be there to support the exhibition, they both will be exhibiting at Arab Health, and they will be exhibiting in two different stands. One of them is healthcare focused stand located on the main concourse CC60, and we will definitely share more details about it. And one life science focused stand shared with Northern Powerhouse and Midland Engine in Hall 2 stand H2. So Healthcare UK this year will be showcasing UK healthcare organization and their innovation in key areas, including digital and artificial intelligence, aligned with the healthcare demands of the region. Their programs of events include programs on the stand, as well a number of some side events. The main activities that they are organizing, so on Monday, which is the first day, they will be holding a reception at the UK Embassy for International Buyers and UK Healthcare and Life Science Company, which can be focused on innovation in the healthcare space. On Tuesday, which is the second day, they're organizing a panel event on integrated healthcare, where they will be sharing UK expertise on closing the loop on value-based healthcare. This will be focusing on clinical care, data and digital infrastructure that underpin the system, as well as how to feed in scalable innovation to improve the whole entire system. On Wednesday, which is like the third day, they will be putting together an event on education and training, and we know that we have some companies on the webinar who are specified in education and training, and this event is going to be aligned with the vast needs across the region to sustainably train and retain a healthcare workforce. On the stand itself, on the Healthcare UK stand itself, they will be giving UK companies the opportunity to meet with international buyers and trade advisors throughout the week. Meeting requests can be booked via their website, which we will share. So we will share with you after the webinar a link that shows all of these events, and we'll show you how to book various opportunities or events, or even one-to-one meetings with trade advisor at post. They are also organizing a market overview, which is going to be delivered by the trade advisors in the regions, covering the market landscape and the main opportunities for any companies. Not yet certain which market they want to enter in, but definitely interested might be interested in exporting to the region. So I think this is Alex's part. Hopefully I was able to manage to cover most of it. What we will do now is we will move on to the question and answer, to the Q&A. Please do send your questions to the chat, which is I think to the right or the left of the webinar, so we can deal with them one by one. I'll hand over now to Yazan to lead on this area.
Thank you, Aya. So we've received some questions, and again, you can type those questions on the right-hand side of your screen. There should be a questions panel. I'll go over the first two questions from a gentleman asking about what the webinar, whether it will be recorded and the slides will be available. Yes, we have recorded the webinar. We will send a follow-up link to all the participants and even those who haven't attended with the slides and a link to download or watch the webinar online. The second question, which is how much generic injectable registration costs, and what is the registration lead time? I think this one is a little bit specific. So Ashish, I think we'll respond to you on that one privately. Moving on to the next question. Is there any specific support being provided for digital health companies, EHRS clinical system providers?
I think that's one for me. So we provide many support for digital health companies in general. We have many activities, as I mentioned earlier. If the question is going to be asked about Arab Health itself, yes, we do have a couple of events which are going to be focused about digital health and artificial intelligence. If we're asking in specific or in this area in particular, I'm happy to have a discussion with Fardeen. Yes, it's Fardeen. I'm happy to have a discussion with you later to see what are the opportunities actually in the digital health area in Saudi Arabia, and what are the opportunities and projects that we can introduce you to. Once you send us more information about your company and services, we will see what kind of opportunities in digital health we can provide you. We can do it as an individual base, or we can do it sometimes as a event base, where we can involve not only your company and as many digital health companies as we can with relevant stakeholders. So I'm happy to take it forward with you separately after the webinar, and we will be sharing our contact details after the webinar.
So one more question.
Can I just add one more point?
Yes, please.
Is there anyone here from Jeddah? Yeah, so one more point to add to what Aya was saying, that we are here to support all sorts of businesses looking at opportunities in Saudi Arabia. So it's not, we don't really cover a specific segment of healthcare. We support any company that's looking at opportunities in Saudi Arabia. So if there is an interest in the Saudi market and we haven't covered it in the webinar, that does not mean that we don't cover that as part of our job, but we do. So if there is something that you want to discuss with us about what your company needs are and what the Saudi market may be in terms of interest to you, please always reach out to us, and we will find the time to support you.
And I have just been informed that we have a Healthcare UK specialist who is a digital health specialist. His name is Hassan. Just whenever we send the link afterward the webinar, you can register your interest to meet with him, or even have more information about how you can get extra information about digital health opportunities. It's all going to be mentioned on the website.
Another question from Hardeen. Can you please repeat the date of the event in January? It's the 29th to the 30th. Sorry.
Yeah, so the date of the Arab Health January, it's the last week of January. It's 27 to 31st of January. And basically the most, I think, from our previous experiences, I've seen the most important days are the first 3 days, where you have the main stakeholders, even ministerial engagement. Most of the buyers, they do present at the first 3 days. So these are the dates.
Right. Next question is, does the
and for the second part, is there still a room for registering for the event? We will send you the link afterwards the webinar to see how you can participate in our events. Okay.
Thank you, Aya.
Can I just also add something to that, if you don't mind? Just a little point. The SFDA and SAGIA have a presence at Arab Health. For those who are interested in the Saudi market, I would recommend stopping at their stands and just having a quick chat about the Saudi market, because they'll give you, all the information that you would need.
Thank you, Ayman. The next question is, does the Ministry of Health fund any screening programs at present? And I'll let Graham answer.
So the screening issue in Saudi is an interesting one. It is an area that's relatively underfunded, underfocused, but they've got a new agency being set up for public health. Part of its remit is to focus on screening, and as part of the model of care screening came up very strongly to identify some areas. Now, what I would say is that they haven't defined that. They're going to do bowel screening, they're doing cervical screening, but it will be coming over probably the next 12 to 18 months. You'll start to see those programs coming through.
Right. The next one is, can you give a little more in detail in relation to the vision for artificial intelligence in Saudi, and who, how is best contact to discuss further?
So again, I'll have a stab at this question. It's not really my area of expertise. What I would say is that there's been a big push, and especially in GCC region around AI. You've seen Dubai invest a heck of a lot of money and focus on AI. What I would say is there's a competitive spirit between all of the countries in GCC. So Saudi is now looking and they view it as innovation. And my colleagues from GlaxoSmithKline talked about the appetite for innovation. They want to be seen as world leaders. So actually, they're prepared to invest money in anything that's innovative that can be aligned and puts them in a much better state than the competitors in the GCC, shall we say. There's another question which I've just answered, which does sensitive patient data need to be hosted on servers in Saudi Arabia? And the answer is yes. At the moment, I don't think we've had formal guidance out, and I will decree to back this up. But the general principle is they don't want any data offshored, if possible. They want it all stored on servers within the kingdom. So at the moment, any system, any process, you need to be thinking about hosting here, and there's a number of companies within Saudi with relatively mature infrastructure for hosting, so that shouldn't be a problem, but it's something to bear in mind if you're looking at a digital solution running as a software as a service model.
Right, I think we're coming to the end of the hour. If you have any further questions, please feel free to email us. I'll send a follow-up email to everyone who have attended and to all of those who haven't, which will also contain the recording of this webinar and the presentation slides. Feel free to reach out with any questions to us here or the team at the British Embassy. I'd like to thank you all for your time, and to thank our speakers for supporting this webinar, as well as our colleagues, Aya, Mina, and Ayman from the British Embassy. Any of you who are interested in coming to Arab Health, also please do get in touch. Again, thanks to everyone for dialing in, and have a great rest of the day.